Sorry for not being with you, and I will just use this couple of minutes to speak about the new developments of the global Exposome community and the infrastructural landscape for supporting the Exposome research. Next slide. This picture shows the history of development of the Exposome field, and it goes back almost 2 decades, and it shows at least some landmarks marking the history of the Exposome field, starting with Wiles and Rappaport's papers in 2005 and 2009, continuing with the first 3 Exposome projects under the EU FP7, the Exposome Center Hercules in the US, and then the following CHEERS and HEAR projects, the first Exposome textbook and the Exposome journal. And of course, there is an important cluster of 9 Exposome projects that are financed under the European Horizon 2020 program. These projects were complemented by the series of various meetings, strategic workshops, boot camps, and the summer schools, building the common understanding necessary for future development of the field. But as these projects are coming to the end now, there are also new developments that should be mentioned here, and these include the European Exposome Infrastructure, EIRENE, that was initiated in 2021, and then the International Human Exposome Network project that was kicked off at the beginning of this year. Next slide. I would like to mention the series of the meetings on accelerating precision environmental health that was organized by US NIH in 2022, and it resulted in the identification of several obstacles to progress with the Exposome research. And you have them on the screen, and they include the lack of data sharing, lack of harmonization, data repositories for environmental health data. It also highlighted a need for establishing the community of practice and enhanced collaboration towards making the Exposome relevant for public health interventions. It is clear that these obstacles need to be overcome to move from the research and development phase to more operational phase, as depicted in the diagram on the right side of the slide. This, however, requires both building the harmonized infrastructural capacities as well as the interdisciplinary global research community. Next slide. To establish the international network that will improve global research and cooperation in the field of Exposome is the vision of the new International Human Exposome Network initiated early this year. But I will not talk in detail about the EIRENE network because I believe that one of the coordinators of this project, Martina Reihai, will have a presentation about EIRENE specifically tomorrow. Next slide. One thing that I would like to briefly mention in this presentation is, however, the effort that complements the European project on the US side, because the US NIH opened the call last year for the U24 Exposome Coordinating Center. The results of this call are not known yet. They will be announced later this year, but the goals of this project include setting up the Coordinating Exposome Center, but also the US Infrastructural Network, as well as contributing to the development of the global Exposome community. So it is very well aligned with the European EIRENE project. Next slide. Of course, there is an ongoing communication between the European and US scientists. And one of these events, besides the series of workshops from 2022, was the Banbury workshop that was organized in the Cold Spring Harbor laboratories in the end of 2023 to discuss the common understanding and needs of the exposome fields. And this workshop should be followed up by the next meeting held in Europe in the end of 2024. Next slide. However, what I want to focus on today is building the infrastructural capacities for the exposome research. Even though the European Human Exposome Network cluster of ongoing exposome projects will result in numerous useful tools applicable in future exposomics, we have to think beyond it. We have to think about the long-term horizon and sustainability of those newly developed capacities. Next. One of the options for building sustainable capacities for exposome research provides the European Strategic Forum on Research Infrastructures, which supports the infrastructural development with a perspective of several decades. However, it is a long-term and highly political process. A need for building the exposome infrastructure has been already identified in 2018 update of the ESFRI roadmap. Next one. In reaction to this ESFRI call, the RECETOX Center of Masaryk University in Brno coordinated the preparation of the ESFRI project proposal, which was accepted for 2021 update of the ESFRI roadmap. The design study shown in this slide identified the key elements missing from the infrastructural landscape that need to be built to better support the exposome research of the future. They included building laboratory capacities for assessment of chemical exposures, environmental and population studies with the chemical monitoring and risk assessment elements, as well as building databases and modeling tools. It was clear that the close collaboration with existing research infrastructures needs to be established to strengthen the synergies and avoid duplicities, because some of the necessary capacities are already offered through the existing ESFRI landscape. Next one. Currently, the EIRENE exposome research infrastructure is in the preparatory phase. It has 20 participating countries currently, including the UK and US. And in many countries, the national nodes were already established, and in many of them, they already secured the financial resources. Next. What we are currently working on is the development of key services, which can be clustered around these 6 domains, including providing laboratory capacities for the assessment of environmental exposures and their biological effects, data and samples from environmental and human health studies, or data evaluation and modeling platforms. Next one. Each of these domains is rather broad and complex, providing many opportunities for future collaboration with existing projects and also existing infrastructural service providers. The exposure assessment, for example, includes internal as well as external component of the exposome, combining targeted and non-targeted laboratory methods with geospatial models enabling addressing multiple environmental and social stressors, as well as toxicokinetic modeling, linking external and internal components of the exposome. Next. The assessment of health impacts, again, combines effect markers that can be measured in the cohorts and population studies, but also novel toxicological approaches and methodologies, as well as methods that are available in the chemoinformatics, bioinformatics, or biostatistics. Next. The topics to be discussed with other national and international projects and research infrastructures include, for example, inventorization and future sustainability of cohorts, harmonization of available data, capacities management and accessibility of data storage and computational platforms, their availability for the assessment of emerging stressors, and many others. Next one. EIRENE is currently, among others, focusing on building sufficient resources for chemical exposomics. These include building the publicly available resources, for example, standard operational procedures, spectral libraries, data processing pipelines, or reporting standards for chemical exposomics. Next one. We are driven by the belief that reproducibility of the exposome research is the key requirement for its future applicability in the public health interventions. And you cannot really reproduce any approach if it is not well documented. This is why we are really investing into building those publicly available resources so everyone can check the quality of the work. And we are strongly pushing for building the internal EIRENE working group that is sharing resources and harmonizing all of our approaches. Next one. One of our major time and financial investment goes into the development of data processing pipelines, because the future of the chemical exposure assessment is in the non-target technologies, and they are quite heavy in the data assessment. And this is also the source of variability coming from the different projects and institutions. So this is why we closely collaborate with the Galaxy community and the Elixir RI in building the Galaxy data processing pipelines that can be publicly shared and that different groups can use for the assessment of the non-target data. Next. This slide is taken from the 2021 update of the ESFRI roadmap. And it really shows the collaborative potential of EIRENE. You can see that the resources that we are building are highly relevant for many different fields, both in the health and food domain, but also in the environmental domain and social domains. At the same time, it shows the existing research infrastructures that are already providing the services needed for the clinical research, for drug design, for development of the models of disease. So those are the interfaces where we need to collaborate and build better understanding and better collaboration across the infrastructural domains. Next one. So in the end of my speech, I would like to open several invitations, because the EIRENE RI co-organizes this year several interesting meetings. First of them is the meeting of Galaxy community in Brno in June, in the end of June this year, where we will have also the keynote and the section that will be looking at the needs of the Exposome community. Another meeting is a joint meeting of EIRENE and EIHEN projects in Utrecht that will be held in the middle of October of this year. And then the third conference is the International Conference on Research Infrastructures that will be held in Brisbane in December of this year. And again, there will be a special section looking more into the collaboration of the research infrastructures to promote the future research in human exposome. And the links to those conferences are included on the slide. Next one. So with that, thank you very much for your attention.